Many Americans are in a frantic race to get vaccinated for COVID-19, as are people in many other countries around the world. Though vaccine supplies are limited, some students, doctors, and researchers in the Boston area have also been focused on access to vaccines at a global level. They recently held a rally near the office of one vaccine manufacturer, Moderna, to call for reducing barriers to a key ingredient, vaccine-related intellectual property. To tell us about the effort by the coalition known as Free to Vaccine Boston, is one of its members, a fourth-year medical student and Fogarty Global Health Fellow at the Harvard T.H. Chan School of Public Health, Parsa Erfani. Thank you very much for being with us, Parsa.
Thank you for having me, Chris.
Parsa, try to connect the dots here between what you're studying right now and what you're concerned with as a member of this coalition.
Yeah, definitely. So as we're seeing the vaccine rollout in the United States, we're confronted in Massachusetts as well with certain populations, vulnerable populations, getting the vaccine at lower rates than other populations. So we're seeing low-income communities, racial minority communities having lower vaccination rates in Massachusetts than we are compared to their white privileged counterparts. And these differences and disparities we're seeing also are paralleled in the global scale. Currently, high-income countries make up 16% of the global population, but have purchased about 70% of the global vaccine supply. It's estimated that there are folks in low-income countries who may not be vaccinated against COVID-19 until at least 2023 or 2024. What that means is that healthy individuals in the United States will soon be vaccinated, as high-risk, older populations in low-income countries will continue to preferentially die from this disease.
The pandemic has maybe pushed people's compassion to the limits here. So why is it important for people in other parts of the planet to not be left behind? Well, why is that important for all of us?
Yeah, I think we're seeing this right now during our national vaccine rollout. As we see the emergence of new variants from across the globe. We hear about variants from South Africa, from United Kingdom, and as they enter the United States, they start threatening our own vaccination efforts. So new emerging data is coming out, and we're learning how these variants affect the immunity that we have from the vaccines in the United States, but we're seeing that we'll have reduced efficacy for some vaccines. So even if we have vaccination shields in the United States, we may be vulnerable as long as this virus continues to circulate in other parts of the world. So I think first and foremost, we think about global vaccine equity being a moral demand of prioritizing human lives, in the sense that lives in wealthy countries and lives in low-income countries are of equal value. But even if we take a more self-oriented view of protecting our populations, it's in our interest to achieve global herd immunity as fast as possible for American health.
Well, what this campaign is trying to do right now is not necessarily unblock the access to intellectual property for making the vaccine, but at least to speed up the access around the world. How much could that actually help?
Yeah, I think that's a great question. The intellectual property waiver you're referring to is a proposal put forth in October 2020 by South Africa and India and the World Trade Organization. And what the proposal puts forward is to temporarily waive intellectual property rights for COVID-19 related medical goods only during the course of the pandemic. The goal of this is to breed international collaboration between different companies, between different countries and governments, to boost production in any company or manufacturer that has the capacity to produce these vaccines. We recently saw a collaboration between Merck and Johnson & Johnson, in which Merck started manufacturing its competitors' vaccines, and that's going to be to the benefit of American health. And that same model needs to be implemented across the globe. We've been seeing it slowly. We've seen India start producing the AstraZeneca vaccine, specifically the Serum Institute of India However, it's happening very slowly and at the pace and decision-making power of companies. What we need now is for our global leaders to be making these decisions and making the decisions that prioritize global public health, and having this loosening of intellectual property laws during an unprecedented pandemic of our time is one barrier that will accelerate global vaccine production. It's not the only thing that we need in order to get production happening in other countries. Technology transfers, data sharing, sharing of know-how with other manufacturers and helping them build capacity to create these vaccines is also necessary. But the large waiving and temporary waiving of this intellectual property for these vaccines and other COVID-19 medical goods is an integral part of the equation.
Well, one of the few things I grasp about the production and generation of vaccines is that they take both public resources and private resources. Maybe the public leverages the private. And isn't there some danger here that loosening up the rights to this intellectual property might diminish the financial incentives to research the next vaccination?
Yes, most definitely. And I think that's often the concern we're seeing in the World Trade Organization, where we see a lot of countries, specifically a handful of countries, wealthy countries with large pharmaceutical industries blocking this waiver of intellectual property. And on the other side of the table, we have over 100 low and middle income countries that are supporting this waiver. And the concern around intellectual property preventing future innovation is overstated for many situations. I think that in the global health community, we're seeing that intellectual property laws can have important incentive structures to promote innovation. But once only some people get to benefit from that innovation, and once it actually starts not being implemented into people's lives, its value to society starts deteriorating. We saw this in the HIV/AIDS pandemic when we had antiretroviral medications for HIV, a scientific breakthrough, and people in the United States got to benefit from that, and we were able to save lives. Meanwhile, due to the high prices of these medications, people in sub-Saharan Africa continue to die disproportionately. These trade regulations were the limiting factor in terms of people accessing medications. And we came together and found ways to reform our trade regulations to promote generic production of these HIV medications. And today we have antiretroviral medications more commonly in sub-Saharan Africa. So the notion of intellectual property, a temporary waiver eliminating all innovation for future vaccine production, I think is a large leap that a lot of pharmaceutical companies are making, but is not a reasonable one. Most definitely, this IP waiver would quell the profits of pharmaceutical companies. But as you said, the investment in creating these vaccines has not been just from the private companies. It's required billions of dollars in public investment. So if the public has been putting their money and resources and capital into this, they should be benefiting from its profits.
Going even to another level here is we're hearing what's starting to sound like a chronic story. It could be this or that kind of contagion. You have these shortages of access to vaccines or some other kind of remedies around the world. And, people, they're living with this all around the planet. I mean, are we getting to the point where this is going to be really destabilizing in a way, it's not just a medical problem?
Most definitely. I mean, we're seeing this in our own country, in our own communities every day. We're seeing the effects of schools closing down. We're seeing the effects of people losing their job, and it's really going to be of great economic catastrophe. Has been and will continue to be so. And I think that what we're seeing is that often that the lowest income countries are going to take the hardest hit of this economic downturn because they don't have the capital that we just saw in terms of stimulus economic packages acting to some sort of safety net for people. So we will most definitely see the poorest in the United States, the poorest in the world being pushed into more poverty, and achieving global herd immunity in the least amount of time will be integral to preventing that.
I want to come back to the short term because you did mention some of the problems with AstraZeneca. And maybe some of the governments who are cutting back on it might be overreacting. Maybe they're not. But how much does that make things more urgent for what you're trying to do with the Free to Vaccine campaign?
Yeah, I think it really, underscores the need and the benefit of achieving global herd immunity as soon as possible. And the sense of global collaboration is needed, and it's not just in the benefit of low-income countries. We saw an international collaboration that came together early on in this pandemic through the ACT Accelerator program. There was a branch of that called COVAX, an initiative, a global initiative that brought together the world and member countries to collectively source vaccines and equitably distribute them to all countries, including low-income countries. And the thought would be that equitable distribution would make sure that we had vaccines reaching the highest risk populations first. That in large has not been successful in its original goal of equity. Right now, its 2021 goal is to have vaccinations for 20% of the population in low and middle income countries. 20% we know will not be where we need to be to reach herd immunity. And it's largely because the COVAX currently is incredibly underfunded and has a low number of vaccines. Its lack of ability to secure vaccines has been due to wealthy countries striking bilateral deals with manufacturers and companies and increasing the prices of vaccines currently. So, international collaboration so far have not been sufficient. And this donor-based model has not been fast enough to get vaccines where people need. So we need to look for another path. And boosting global vaccine production and working in every single facility that has manufacturing capacity and can produce these vaccines efficiently will be key.
Well, thank you very much for taking the time to join us.
Thanks so much, Chris.
It was Parsa Erfani from the Free the Vaccine Coalition.